Romero Salinas at Lincoln University. I am an extension state specialist, and I am so happy to be presenting now, starting with our new season and the episode about the reproduction. So today we have Dr. Katelyn Waters from Auburn University in Alabama, and she will be talking about the reproduction in the males in the ram, and later on, other day, we are be talking about the females. So, Dr. Katelyn, you're very welcome. Do you want to present by yourself, please?
I'm Katelyn Waters, like he said, and I am an assistant clinical professor at Auburn University. I work in the Farm Animal Field Services Department. Theriogenology is my area of expertise, and so repro is what I do most of the time. And I did a therio residency here at Auburn, and I was lucky enough to get to come back as faculty. And so I'm excited to talk to y'all today, and thank y'all, Lincoln University, for having me. This is an awesome webinar and series, and I can't wait to present this to y'all.
Dr. Waters for being here. Hello, I'm Mohan Acharya. I work as a state extension specialist here at Lincoln University. Before coming to Lincoln University, I was in Arkansas working with small ruminants for 10 years. I finished my graduate school and postdoctoral training, all in small ruminant research. Thank you. Thank you all.
Thank you, Dr. Mohan. Dr. Waters, we are extremely excited to have your expertise with us here today. And we are excited for our small ruminant webinar viewers to meet Dr. Mohan. We are excited to be fully staffed again here at our program at Lincoln University. My name is Amy Bax. I am moderating the chat. So if you are joining us live, please go ahead and drop your questions into the chat, and I will make sure that our speaker has an opportunity to address them. If you are viewing this as a recording later, please feel free to email myself or Dr. Salinas or Dr. Mohan, and we will make sure that those questions get addressed. For anybody that needs it, my email address is Bax, B-A-X-A, the number 2, the @ linkonu.edu. We'd love to hear from you guys. And with that, Dr. Waters, it's your turn. You're up.
All right. So I am super excited to talk to y'all about this. I really like small ruminants. They're a lot of fun, and they're really cool animals. And so mainly we're going to talk about the ram today and his breathing soundness exam, just because the research is really there in the ram versus the buck. There's been some research in the buck, but for the majority, we extrapolate from the ram and use it on our buck friends. And so there's a few differences, and we'll talk about them. And if I say anything confusing or anything like that, if y'all have questions, we can stop in the middle, whatever works best for y'all. And then there's my email, and it'll be again at the end. And just thanks again for Lincoln University. This is awesome, and I'm so glad that we're getting to producers like this, and we get to talk with y'all. All right, so just a brief outline. So we're going to talk about the breathing soundness exam. You know, when do we do it, and why do we do it? Why is it so important, and why do you hear repro people talk about it all the time? And so we'll go over the physical and reproductive exam that goes along with the BSC, the scrotal circumference and its role. Why is it so important to us in our ruminant animals? And then our spermiogram abnormalities. This is really kind of more what the veterinarians look at. And so you hear us throw out terms about distal mid-piece reflexes, and sometimes you get the opportunity to see those when your animal's in the hospital or out at the farm, but not often. And so just wanted to throw those up there, and so you can see them. They're pretty cool to look at too. And we'll talk about some male management, just kind of basic overviews of these are the big things that we look at. And then I couldn't talk about small ruminants and breeding and their reproductive system and not talk about urolithiasis, because it plays such a big role in these guys' lives and in veterinary medicine. And so we'll talk about, how to prevent that, what to do if you get it, and things to look for. So when do we do this breeding soundness exam? So 30 to 60 days before your breeding season starts. And everybody's breeding season starts a little bit at a different time. Everybody kind of manages in their own way. And so we say 30 to 60 days because the reason why is that we get to evaluate the male, and then you have time to let the male recover if we find anything, like he has an abscess on his foot, or he has some foot rot we need to take care of, or he has, sperm abnormalities that we say, hey, they're here, but we can give him a spermatogenic cycle time, which is about 60 days. And we can let him make new sperm and we can check him again, and then you can use him with your herd. And then if we find something that isn't fixable or something that we say, hey, you probably don't want this in your flock or your herd, then you have time to find your replacement male. And so that's why this 30 to 60 days is what you hear a lot of. Some of the literature for bucks says a little bit shorter of a time, but I think that's a good window. That way you don't get stuck not having a male. So the parts, so there's always 4 big parts that we do with a breeding soundness exam. So it's going to be our physical exam. We just make sure that they're systemically healthy. We'll do a reproductive exam, and then we'll check their scrotal circumference, and we'll do a spermiogram. We're going to go through all of these separately. So our physical exam, a big thing that we look at is going to be limbs and mouth conformation. So we want to make sure that we don't have any big limb abnormalities that's going to prevent this buck or ram from being able to breed properly, right? So they have to mount the female, they have to have structurally sound limbs on the back end to make sure that they can hold themselves on the back end. And we talk about this in bulls a lot because bulls are big, but these guys have big old bodies, and you know, sometimes their legs aren't as big as you think they are for as massive as some of these rams get. So we want to make sure that they're structurally sound. And then the mouth is important, right? Because if we have a really bad overbite or underbite, they're not going to be the body condition score that you want. And then they might also pass that on to their offspring, right? And so we'll look at their feet also, because if they need a foot trim, we'll usually say, hey, they need a foot trim. Let's give them a trim before we go ahead and pass them as excellent or satisfactory or whatever ranking that they get as far as their classification at the end of the exam. And then also we want to make sure that they're systemically healthy. So they need to be able to see the females, and they need to be able to walk to the females to breed them, right? So that goes back to the structurally sound limbs. And then their eyes, we want to make sure we don't have any big pink eye ulcers or big scars from pink eye, because that can make it harder for them to see the females out in the pasture, especially if you have a herd that's on a really big range, if they have a huge pasture, or you know, if there's some that are like free roam basically. And so we need to make sure that they can find those females and get to them and stay sound for you. And then also the breeding condition score. So it's out of 5, right? So what we want to look for, and I have some pictures in a minute about body condition scores. And so we want a 3 to a 4, because we want them to have some fat cover, but we don't want them to be so obese that it starts to break down their limbs and give them joint problems, right? And so here you go. Here's the picture for goats. And so this comes from the Purina website. It's just a nice chart that's kind of easy to follow. And you can see here from the back end what they'll look like, a 1 through 5. And we really want them in this 3 to 4 range. And the same for our sheep friends here. And so again, the best way to look at these guys is going to be from the back and from the side. They should have really good fat cover over their ribs. Like you want to be able to feel ribs, but you kind of want to dig for them at the same time. Like you don't want to just be able to run your hands down their ribs like a washboard, but you want them to have a little bit of fat cover there, but not so much that they have big globs of fat down their sides, right? We don't want them obese. And a big thing with this, especially in your growing rams and bucks, is if they grow too quickly and they lay fat down too quickly, then they'll lay fat on their reproductive organs. And so we see this a lot in bulls, is that if we get our bulls too heavy, too much of a body condition, then they'll lay fat around their inguinal rings. And so their inguinal rings are where their spermatic cord leaves the body and goes down to the testicle. And so right at the body wall, they'll lay fat there. Well, then when they go breed, you know, they don't think about eating, they think about breeding these females. And so when they go do that, they tend to lose body condition. They'll lose that fat in that inguinal ring, and you can run into inguinal hernias where the intestine will come out through that inguinal ring and then be in the scrotum. And so it's more common in bulls, but it could definitely happen in rams and bucks. And so just that's one thing to be mindful of with the body condition score and then laying down fat. So our reproductive exam is the next part of our breeding soundness exam. And so we'll look at their external genitalia, so their penis and prepuce. And so we'll look at their haired sheath, which is the haired prepuce. And so things that we look for there are going to be, do we have stones or like grit? Is it ulcerated? Because that can be indicative of certain diseases. And so it also can say, hey, do we have grit here that looks like urolithiasis? Do we need to start a prevention to make sure we don't end up with bladder stones, right? And we'll talk more about that a little bit later. And then the testicles, especially in rams, it's important to make sure you don't get too far out of the breeding season when we do these exams, because rams have a really big seasonal change as far as their testicular size. Their testicles will get a little bit softer than they normally are. And so their BSE may not be quite indicative of what they're capable of if you're too far out of the breeding season. And so that's one big thing there. And then the epididymis in the rams, especially. And so if you look at this image here, so this is obviously the back end of this ram. And so this person is holding down the testicles into the scrotum. And so this is the way we measure them. We get the testicles as far down in the scrotum as we can to make sure that we get an accurate representation and that the testicles aren't sucked up next to the abdomen, because it can make them seem smaller. And this is a big part of our exam, right? And so we'll push these testicles down, and then we have a couple different instruments that we can use here, this scrotal circumference tape, to see how big these testicles are. And it's important, and we'll talk more about the scrotal circumference in just a second, but I wanted to show you this image because if you look at the bottom of the scrotum here, these are going to be the epididymis in sheep and in bulls and rams as well. And so what this is how the sperm leaves the testicle and goes out through the penis and is ejaculated. And so what happens in rams especially is they'll get epididymitis. And so a huge number of rams, you know, that's probably one of the biggest reasons that they fail a BSE, is because they have some form of epididymitis. And so young rams get it for different reasons. Older rams, usually the top differential is going to be, do we have brucella? And so that's a big thing with these guys that you can see on the farm too. If you have a ram that's one testicle looks big and you say, hey, it looks big at this bottom, do we have epididymitis? You give us a call, we come out, we say, yeah, let's test him, and we can go from there. But when we test them, we measure here at the widest part of the scrotum for the scrotal circumference. And then the penis will extend once we start electroejaculating them to collect them. And I'll show you images of that in just a minute. Internal genitalia, we really don't palpate them like we do bulls. They're just not quite big enough. Some of these huge rams you might could, or if you thought you had a problem with the accessory sex glands, we can palpate those guys sometimes, but for the most part, we might put an ultrasound rectally, but we don't see a whole lot of issues with the accessory sex glands. And here's just another image. You can see these epididymis really well at the end or at the bottom of this scrotum here. So scrotal circumference. So just like we looked at that picture of that ram a few minutes ago, or just a minute ago, we're at the widest part of the scrotum here. And when we read these things with this scrotal circumference tape here, we're going to read it at this bar. And so this buck right here, he's like 19 and a half. And so the reason that scrotal circumferences are so important in ruminants, and you don't really hear about it in like stallions, is that with a stallion, when you collect them to look at their semen, you get a true ejaculate because we use an artificial vagina and let the stallion ejaculate like he would if he was breeding naturally. With the ruminants, we pretty much exclusively use the electroejaculator, just because most of, at least the ones that I see, aren't trained to an AV. When you go to bull studs and things like that, they'll be trained to an AV, but folks came up with a formula that it shows the scrotal circumference is indicative of the volume or the weight. They're going to be hand in hand of the testicle. And so that's going to tell us how much this animal can serve, how many females can he breed. And so that's going to be his serving capacity. And in bulls also, the larger the scrotum, the earlier the age that their daughters reach puberty. And I haven't read a whole lot about this in sheep and goats, but I would think it's probably linked there too. And so that's just a water speculation, but I would think that it's linked there too. So some charts for you, and if y'all want this PowerPoint, I sent it to them. And so if they want to share it with y'all are welcome to. And all the references are at the bottom for the charts where they came from. And so here's what we use as references when we're doing scrotal circumferences. And so it's all based on age. And so a ram is going to have, it's pretty impressive. They have a scrotal circumference that's equivalent to a mature bull. And so rams have pretty large scrotal circumferences. And so if they're 18 months or greater, like right here, we need to have a 34 centimeter scrotal circumference to be an excellent, like exceptional breeder. And then for the bucks, it's not super well documented, but for the most part, we just use, if they're greater than 14 months of age, they need to have a greater than 25 centimeter scrotum. And so you'll see some different things for dairy breeds out there. I think they're a little bit larger than the meat breeds. For the most part, the references that I saw that I know are going to be 26 to 29 are going to be your average bucks. So on to our spermiogram. And so I just wanted to go through the kind of process that you'll see if you bring them in and what to expect. And so here on the left, these images, this top one is going to be artificial vagina for small ruminants. And so they can collect these as a more natural, you'd have a female and they would mount the female and their penis would be directed into this artificial vagina here. And the semen would go down here into this this tube. And then right here at B, we have the scrotal circumference tape, which I've already seen. And then C and D here are two different types of handheld electroejaculators. And so you can see in this image on the right, this is how we use these. There's also another one that attaches to the electroejaculator that we use for bulls. And I think, honestly, that's probably my favorite. And I don't have an image here to use. I feel like you can control it a little bit more because these are just kind of an off-on mechanism, where the bull one is you have a dial and you can turn it up and down and kind of adjust it to what your patient or like what animal needs which setting. And so I'll tell you that it's my preference when we collect these guys to sedate them. And so bulls, we don't sedate, we put them in a chute, we restrain them. And so I prefer to sedate the small ruminants, especially the goats. The sheep handle it okay sometimes, but we give them a little bit of sedation. Sometimes they lay down, sometimes they don't. And then I feel like they handle it a little bit better because sometimes they can vocalize. And it's not that this is painful. I think it's just, I'm sure it's odd, right? And so on to what else the spermiogram tells us. And so when we collect these guys, the first thing we see is the color of the ejaculate, right? And so what this tells us on its own is if we're really cloudy, then we're probably really concentrated. So concentration is important because, hey, if this is concentrated, we have a lot more sperm. And hopefully that means we have a lot of normal sperm. And so you can see here in this image that from left to right, you go from super concentrated to pretty dilute. And so what this means is that this animal, whether it was a ram or a buck, whoever, on the left is going to need less semen to breed the same amount of females as this one on the right. And the one on the right, I would bet, has an issue. It almost looks bloody, but the more concentrated, usually the better. Now, concentration is not the end all to be all. We have to do all the things, but it's pretty helpful sometimes, especially if you're going to have a ram that's breeding 100 ewes, right? And so here we go, just as the kind of overall chart of, hey, what all are we looking at? So we've got our scrotal circumference that we talked about. And so on our spermiogram, we're going to talk about motility and morphology. And so after we collect the semen, we're going to look at it directly under the microscope and say how many sperm are moving in a forward fashion. So that's going to be our motility. And so for rams, we want greater than 50% to be excellent. And then morphology is going to be how many percent normal sperm do we have? And so this is super important. And when you get your rams and your bucks and your bulls checked, you want to make sure that they do check a morphology, because often, even though their motility will be good, their morphology is where you have an issue. And then we also look for white blood cells, because white blood cells indicate there's an infection, right? So there's some kind of insult. And then bucks, again, we don't have as much research. We pretty much just extrapolate from the rams. So just a few images, because I think sperm are pretty cool to look at, and it's pretty neat to see what we're talking about when we say, hey, yeah, they had this or they didn't. This is a variation of normal. So this is what a normal sperm head should look like. This is actually a bull, but the rams and the goats look pretty similar. So this is the head, and then you've got a mid piece and a tail. And so this part right here is called a distal mid-piece droplet, or a distal droplet, if you will. And so this is a normal variation. These will fall off once they're in the female reproductive tract. And then again, just another image. And the stain that we use for this is a live dead stain. And so what it does is that the live ones will be white when they stain, and the red ones will be the dead ones when they stain. So red is dead, right? And so this is a normal variation as well here. So abnormal, so I would tell you in my experience that this is the most common abnormality that we see, especially when it's hot outside. And so this is called a distal mid-piece reflex. And so we can tell the difference from this one here that had a normal mid-piece that was straight and kept going down, and the tail it's just a pretty straight overall individual there. And then here we've got the head, and then we've got the mid piece that reflects back on itself kind of in a J shape. And so that's our distal mid piece reflex. And so when veterinarians tell you that it's probably a heat issue, to me, this is going to be the most common or most likely thing that they've seen on the spermiogram to say, hey, it's hot outside. We have some changes to the sperm, and this happens in the epididymis after it's been formed. And so the good thing about being able to classify these from a veterinary standpoint is we can say, hey, I think he'll be fine. Let's bring him back in 60 days, recheck him. It'll be cooler outside. His sperm will probably be normal then, and we can recheck him, double check, and then he can go back and breed the females. And then here we go. We just have a few more examples just because they're pretty to look at, right? And so you can just see all these distal mid-piece reflexes. This one right here in the middle is a little bit different. This is a DACT reflex, and that's usually in bulls. And then this here is a distal mid-piece reflex as well. This guy right here, this is a proximal droplet. So it's the same cytoplasmic droplet as a distal droplet. But what happens is that when these sperm are formed, they leave the testicle with this droplet on them. And as they mature and go down the epididymis, getting ready to be ejaculated, this distal or this droplet moves down, and it's kind of a sign of maturation. And so we can look at these and say, do we have a lot of these? And if we do, is this a young animal or an old animal? Because a young animal, this is going to be a sign of immaturity. We're not quite through puberty yet. We probably need to grow some more, maybe take him home, put him on a few females and see if we can get rid of those, recheck him in 30 to 60 days and see if he's matured some more. Now, if this is an older animal, I would worry that this animal has testicular changes. Does he have testicular degeneration where we have changes to the testicle itself and the sperm isn't forming normally anymore? This is a really pretty one. It's not super common, but it's I just wanted to show y'all the really cool ones to look at. And so this is a terminally cold tail. And again, this is usually a storage issue. Just a few more pictures. This A here, so this is one of the, anything that deals with the head is going to be kind of a really bad prognosis. It's going to be one that we definitely give them 60 days, say, hey, did we have a fever? Because fevers can cause issues with the testicle and the formation of our new sperm. And then this is called a knobbed acrosome. And then B is going to be a macrocephalic head, so the head is too big. And then C, it has a couple issues. It's got some vacuoles in the head here, and then it's got a terminally cold tail. And so these are all bad fellas here. So on to our classification. So we take all this and we put it together. And one thing I didn't mention about the testicles is that when we're palpating the testicles, we're making sure that they're the correct firmness, because we tell students that we want them to be the consistency or the firmness of a flexed forearm. And so if they're too soft, do we have a problem? Are they degenerate? Is there an issue? Are we going to come back from that? Or if they're too firm, do we have fibrosis? Did something happen and now we have scar tissue in those testicles? And so those are important things with just palpation of the testicles. And so for the rams, we have 4 different classifications, and in the bucks, we really just use 3. I don't think it's wrong to use the 4 for the bucks. Like I said, we extrapolate from the rams. But the rams excellent is going to be that you can have 1 ram that'll breed 100 females. And so that's excellent. And then if we deem them satisfactory, you put 1 ram with 50 ewes and you leave them out there for 60 days and you should have good results. And then questionable means that they failed at least one part of their exam. So was their scrotal circumference too small? And so then do we come back and see if it gets bigger when it's in the regular breeding season, or does he have foot rot and we need to treat that foot rot and come back? Or do we have a foot issue, a lameness, something that we can treat? Did we have pink eye? Something we think that he'll come back from. And then the unsatisfactory means that he didn't pass any part, like he failed all the parts. And so this is a male that we say, hey, I don't think he's ever going to come back. These are issues that we can't fix, whether it's sperm that are all testicle issues, or if it's a lameness that he has blown out his stifle, and that's kind of the end of his career. And so our bucks, like we talked about, there's 3. The biggest difference is that we usually don't classify them as except excellent. We usually just go with satisfactory, questionable, or unsatisfactory. So some male management. So routine hoof trimming. This helps prevent lameness. It helps prevent diseases like white line disease, where the hoof wall starts to separate from the sole. And it helps with foot rot as well. Now, foot rot's its own entity, and it can be pretty gnarly. But I would say every 6 to 8 weeks is a good thing if you can do it that often. Some of our pet goat owners definitely do it that often. In a production setting, you could probably do it, based on what kind of land your animals are on, or just based on what your animal's feet look like, and you can do it as needed. And then parasite control. I'm in Alabama, so the Southeast, we are the first differential when an anemic goat comes in is always going to be parasites. Probably the first 3, the first 3 things we rule out are going to be parasites, because it's hot, it's wet down here. And so we use the FAMACHA score a lot, and most of y'all are probably familiar with it, but if you're not, it was made to help differentiate, do we have an anemic animal? And so we can push on their upper eyelid onto their eyeball and then pull down on their bottom eyelid, and then we can expose this conjunctiva here. And there's a whole course you can go through. Once you go through the course, they'll send you this card, and you can be FAMACHA certified, and you can do it for your own animals. But really the biggest thing here is that we're making sure these animals aren't pale. Their conjunctiva should be pink, just like ours, right? And so what we do here at Auburn is that we use a 3 dewormer protocol, and we use the FAMACHA in conjunction with the fecal egg count. So McMaster's is maybe what you heard it called, but McMaster's, and then in concurrence with the FAMACHA and kind of the clinical animal. I'll tell you that I have seen recently a fair number of animals that have really, really great FAMACHAs, and they have super high egg counts. And so it kind of goes into do we deworm them? Do we not deworm them? And depending on the program and depending on the animals, if they're losing weight, but they still don't look anemic, if they're losing weight, I would go ahead and deworm them with that triple protocol. And then we check them 10 days later to make sure that they had a reduction in their egg count. And so that's how we kind of manage them here. And I'll tell you that the best thing I can tell you is that goats are browsers, and sheep like to eat off the ground. Keep your grass above 2 inches tall, and that way the parasite can't climb up. They can't ingest the parasite. And then if you can vacuum your pastures, things like that, have lots of browse for your goats, keep your hay off the ground. Those sort of things are going to be the big things that I tell our producers here about parasite control. And then I also wanted to put this website here for y'all, this wormx.info. I know when you first look at it, you're like, that seems kind of odd, but it's a really great website, and it has a lot of great information, and it has anything from basic to all the way. It sends you to super in-depth research papers. And so things that it's just a good source for reliable information. And then I'm always happy to answer questions if you'd like to send them my way, but this is a good resource for y'all. And then just making sure we have them on a good plan of nutrition. Like we talked about, we want that 3 to 4 out of 5 body condition. And again, the body condition score, and then the vaccine and biosecurity. So make sure we isolate any new animals on our farm for at least 3 weeks. And then the vaccination, the one we do most common here is CD&T, and we don't have a lot of clients that do a whole lot of others as far as goats go. And we pretty much just do CD&T with the sheep, but there's lots of options. And so I included this chart for y'all just so you can have it if you'd like to see. This is from the Sheep, Goat, and Cervid Medicine book. And so this is these are lots of different options for vaccines that your flock or herd can be. And so especially if you have a certified, we're free of this herd, this could be a good resource for you.
Can I interrupt real quick?
Oh, sure.
Yeah, there's a comment in the chat. Let's revisit it just briefly. I know that's not our main topic, but
yeah,
we have a listener that has commented about FAMACHA,
yeah,
and that it's not to detect anything other than barber pole worms. So I didn't know if you wanted to expand on that just a little bit, maybe things they could do to detect other kinds of parasites, or like you do a FAMACHA, your goat looks really poor, but your FAMACHA is a 1. Like, what are some other things perhaps that you could do as a producer?
Yeah, so I think that's a great question. And parasites can be super frustrating, especially for producers. I worked with one yesterday. She has amazing looking goats, and she's having weight loss. And so what I would tell you is that when their FAMACHA looks like this goat right here looks pretty good, right? I'd call it probably a 2 out of 5. And so what I would tell you the next step would be is let's do a fecal egg count. And if our fecal egg count is low, so when we deworm goats and sheep here is going to be at 1,000. So if they have 1,000 eggs per gram, then we say, hey, we need to deworm this animal. But if it's less than 1,000, we say, okay, this animal probably doesn't need to be dewormed. Why do we look like this? And so then I would tell you that then we move on to diseases somewhat like yonis. And so if you have an animal that's eating well and losing weight and has diarrhea, then more specific diseases are going to come into play. And so that's kind of how I would manage that, is say, do we have, and then the other big thing would be, are our teeth okay? Do we need something as simple as a dental? And that's why we're thin, because they do get dentals. Sometimes they're a little bit hard because their mouths don't open as high, right? Like as a horses get dentals all the time. And so do they need their teeth floated? So that's a big thing. And then to make sure we just don't have any lesions in our mouth, because those things happen commonly. Yeah. And they're somewhat easy to fix sometimes. So those would be big things that I look, and then to make sure that the nutrition is where you want it to. Did we have to change hays this year? This year in Alabama, it's been in drought. I'm not sure about everywhere else, but definitely the hay quality is different than it is in other years. And so making sure we have the good plain and nutrition, our teeth are good. Do we have a high fecal egg count? And when we look at a fecal egg count, we're looking at what we call the hot C complex. And so it includes the barber pole worm, Haemonchus, but it also includes a couple other trichostrontiles. And so when we look at that, we can't tell you, hey, it's this worm versus this worm, unless we let it hatch out and then we measure it, which would be a thing for a parasitology lab to do. And I'm sure that they can do those things. We don't do them commonly here. We just go ahead and deworm with our triple dewormer, but they are possible to do. And so if they're not anemic, it may be that it's another trichostrongyle. And so that would kind of be my answer for that. Okay, so urolithiasis, if you have male small ruminants, I'm sure you're pretty aware of this. And so I just wanted to talk about this because it can happen in our intact males too. So you hear about it really commonly with folks that got little goat kids that were castrated early in age, or little rams that were castrated early in age. And so they, when they go through puberty, their urethra expands up to 7 times the diameter before puberty. And so what we want to do is that we want to make sure we don't castrate these animals early. Now, this is a repro talk, and so we're probably not castrating at least all of our animals, right? We have at least one male. And so you're like, well, my male's intact. His urethra is at the largest diameter that it would be. And so the things that I would tell you about these breeding animals is that we want them at the good body condition, and you have to supplement grain sometimes to do this. But if you can do a good forage, and minimal grain is going to be a good way to help prevent this. And we talk more about that on this next slide. But things that you'll see as a producer is that he may be off by himself. He may be looking like he's straining to defecate. Most of the time when producers or pet owners call us, they say, my goat looks like he can't poop, and I haven't seen him poop. And so when he gets here, it's actually that he can't urinate because their stance is very similar and they just look painful. And then when you see them do this, you won't see that strong urine stream that they usually have, and you'll you may get to see them dribble urine if they're not fully blocked, if they're only partially blocked. And this is an emergency, especially if it's a breeding animal that you want to maintain as a breeding animal. And so prevention and management, so limit the grain, because grain is a really big factor in this. And then high quality forages, but we want to limit our legume intake, because one type of stone, which actually is the stone in this image here. So these are called struvite stones. And this is usually what we see with animals that are on a high grain diet, or they get lots of alfalfa, things like that. This is the stone where that comes from. And so when you hear folks talk about preventing urolithiasis, they're talking about preventing this stone right here, usually. And they usually say use ammonium chloride for it in the feed. And so ammonium chloride changes the pH of the urine, and it helps not let those stones form. And if they do form, then it helps dissolve them. And so that's where the ammonium chloride comes in. There's other stones that can cause the same disease, and they're a little bit harder to treat sometimes because some of them don't dissolve, things like that. And then there can be reproductive life after successful treatment for this. So I put this picture from Zoetis of this small ruminant penis up here, and the ram and the buck are a little bit different, but for the most part, they're the same as far as their penis structure and everything. So on the right here where it says urethral process, so this long spaghetti looking string at the end is actually an extension of the urethra on these guys. And so what happens a lot of times is that they get the stone, they'll have stones in their bladder, the stone will come down the penis and the urethra and get all the way to the glands, and then it gets even narrower out here. And so the stone often gets stuck right here at the end of the glands. And so what we can do, and this is usually the first thing that we try if you bring a small ruminant in that is blocked, we'll amputate this urethral process. And so you say, well, you just cut portion of this breeding male's penis off. It's okay, because this portion here, what it does is it sprays semen onto the external cervical os in the female's reproductive tract. And once you remove this, if the stone dislodges and they can urinate, it doesn't really change the breeding afterwards. This portion right here, they can still breed successfully without it and have minimal to no issues. And so the big thing is that if this doesn't fix it, then it's a surgical correction. And there's different types of surgeries that we can do. One in particular, a tube cystotomy, it's the most likely to take them back to reproductive reproductive success. But it's a pretty gnarly disease that sometimes, they don't have good outcomes sometimes, even with surgery and the most, I guess, the gold standard treatment that we can do. And so the best thing I can tell you is that if we can try to prevent this, it'll be really beneficial for you, because it can be pretty terrible. And we've actually seen a few intact males here recently have this. And I'm happy to take any other questions.
All right, thank you very much, Dr. Waters. This was super fascinating. There is a question in the chat. If a ram has a scrotal split, is this a reason to not use him for breeding? How much of a split is okay, and is this heritable?
The scrotal split, as in at the bottom of the scrotum where the epididymis is?
I assume so.
Okay, and so I think that as long as it doesn't go past, and I'm not an expert in this by any means, as far as like the scrotal slit, and I may actually have to read and tell you if they've found how much of a slit is okay. But I will tell you, if you ever have one that has a complete split, that I probably would not use that as a breeding male. If it has two scrotums, like one testicle in one testicle in the other, because that can be kind of a form of hypospadias that's linked to that poled intersex syndrome. And so I think that the minimal split that goes just above the epididymis is okay, but if it goes all the way up, I wouldn't use that male as a breeding animal.
Okay, thank you.
Yeah.
In your breeding exam, can you comment on a herniated penis?
Herniated penis. I'm not sure if I know what you mean. Like in a bull where there's a preputial laceration and the prepuce herniates, or the actual penis is hanging out?
Jean, can you clarify your question, please, or your comment?
Yes, I said herniated penis, but it's actually the herniated umbilical cord. Have you ever seen that?
I guess do you just mean like an umbilical hernia?
Well, so my cousin's a vet here, and so I've been doing these things for many years, and I had a ram, probably 3 years ago, that he was about 18 months old, and so it was his first test. And when my cousin went down and looked, he said, "Oh, he's got a herniated umbilical cord, and it's genetic." So what it is you'll see the penis extend out, and right at the base, probably an inch to 2 inches up, kind of inside the lower cavity of the stomach, you'll see a bulge, and that's the herniated umbilical cord.
I got you. And so we see a good bit of umbilical hernias. I think that's what you mean. And so the skin is still there, right? Like there's not intestine or anything hanging out. Like the skin is still intact. Yeah,
Sure.
It's
just a little bulge. And
and
he said it's I said, well, should I put him out? And he said I would not. And he would just go ahead and sell him, go eat him. So
yeah. And so I think that I don't think that we know exactly how heritable it is, because we sure fix a lot of umbilical hernias here. Now, I'm not saying that it's right. And I think that if it was my herd and I was worried that anything was genetic that I didn't want in my herd, then I would call them. And whether it's a congenital thing that's not hereditary or it is, I'm not exactly sure, to be quite honest. Like, I don't know how hereditary it would be.
Okay. I have another question.
Sure.
If you don't mind.
No.
What you didn't show us, and normally I'm the one, handling my bucks and putting them in the squeeze chute and everything, where he can, when he puts them under a microscope and it's got a little click counter, and as he's literally looking at each sperm and he's counting them. You didn't show us that. Is that? And then I saw Dr. Sean. Oh, dang it! Texas A&M. Sean. I just went blank on his last name, but anyhow, I'll think of it here in a minute. Ramsey. And what he does a similar deal, but he's just looking for like what he calls a hurricane effect, where you're just seeing a bunch of movement in the sperm under the microscope, which you didn't really talk about a technique that Auburn uses, and I understand Auburn's got a good vet program. So what techniques do they teach there, or what do y'all generally recommend?
Yeah, so I think you're just asking about the motility and morphology, and I'm sorry I didn't explain it well. And so the motility, and this goes back to kind of our concentration here, right? And so we'll take this tube on the left here, for example, and so this is highly concentrated. We'll put a drop on a slide, and then what we do is we look under the microscope grossly, and we look for what you're calling that hurricane effect, especially in bulls. And so what you want to see is a big wave motion, and that's the gross motility. And so in the bull world, at least, we've moved away from gross motility and we do individual motility. And so what I do is after I've looked at the gross motility, I take the edge of a cover slip of the slide, dip it in the semen sample, and then put it to the side. I go on a higher microscope power, and then I look for individual motility. And so when we do bulls, especially, we do individual motility. So do we have greater than 50% individual motility? And then the morphology, and so I guess I didn't explain it well here, but this is what we're looking for when we look at the individual sperm, and we do count to 100. And so if when we're looking at this chart here, this morphology, we want 90 out of 100 to be normal. And so that's what these sperm are. These are when we look under the microscope after we've stained the slide to see what do the individual sperm look like. And so that's going to be their individual morphology.
Ms. Katelyn, you're not sharing your screen anymore. They can't see the chart you're referring to.
Oh, that's sad. This here. Can you see now?
Okay.
Could y'all see any of that? Sorry, I don't know why it stopped.
Yeah, no, you're good now.
So did y'all hear everything that I said though?
Yes, ma'am.
Okay, so this right here is the individual morphology that you're talking about. And sorry, I guess I didn't go into great detail because I guess I did it more what the producers would see versus, that we count to 100, and that's how we get this morphology. But we count to 100, and then greater than 90% is going to be your excellent rams. And so we do each one individually. And this one, right here is a good example of a slide. Now, this is not a light microscope. This is an electron scanning microgram, but so we do those things too. Yes, sir.
Are there any other questions we could entertain? I have nothing in the live chat from Facebook, but we have about 3 minutes left. While we're waiting on any questions, I do want to let the listeners know that we will be handling the female side of this, the ewe and doe side of this ewe management on November 17th, which is also a Thursday. If you'll log in through the Mid-Missouri Goat and Sheep Solutions Facebook page, you should be able to access the information. We will record it and post it. Again, that is November 17th. We will be at noon Central Time. I'm not seeing any other questions. Dr. Mohan or Dr. Salinas, do you have anything to add before we sign out?
On November 2nd, we have a ram breeding evaluation hands-on clinic on November 2nd. And that would be a practical session where we will be doing physical examination for a ram breed selection and hands-on practice for semen collection and semen evaluation. That would be on November 2nd. You guys, everybody are welcome to register for the meeting. That's in the Facebook page.
Okay, so
That's
that
all.
event is in Jefferson City, Missouri, in case people are wondering the location. I
Yeah.
believe it's free to attend, correct, Dr. Mohan?
Yes.
Yep, hands-on workshop. It's a good extension program. It'll be great education if people are available on November 2nd from 9 to noon or 8:30 to noon in Jefferson City, Missouri. Please check out Facebook for more information. If you have questions, please send an email and we will try to get those answered. And again, November 17th is the Female Reproductive Management webinar. Dr. Gonzalez, any parting words?
Yes, just to say thank you so much to Katelyn. It was amazing talk, and we are so happy to have you here and just waiting for the next talk next month. So thank you everybody for being here, and thank you Amy and Dr. Mohan. Yeah.
Okay.
Thank
Bye.
you. Bye.
Everybody have a good day. Thanks, Dr. Waters.
Thank you.